Hello, good afternoon. My name's Sarah Page. I am a clinical research fellow working with the Parkinson's team in Cardiff and Vale University Health Board. I'm also a registrar in geriatric and general medicine. And I'm going to be talking to you about My Parkinson's, which is a web-based application for people with Parkinson's and their families and carers. So I'm just going to start by talking a bit about Parkinson's, which is a progressive, degenerative, complex neurological disease. It is well known for tremor, but also rigidity and stiffness and balance problems are a big part of it. Then there are non-movement symptoms, problems with swallowing and speech and sleep, with cognition and continence, and mood and pain. And despite ongoing research, there's no cure, and so our treatment options are supportive. There's evidence that regular, specific, targeted physical exercise can reduce the progression of some symptoms and delay the onset of some symptoms. And so there's a huge role for the multidisciplinary team in managing people with Parkinson's and their families and other people affected by Parkinson's. There's a group of researchers in the USA who say that Parkinson's is the biggest, fastest growing neurological disease globally. And closer to home, the Parkinson's UK charity estimates that over 7,200 people in Wales have Parkinson's. There's an increased risk of being diagnosed with Parkinson's as you get older, and currently the likelihood of being diagnosed with Parkinson's at some point in your life is 1 in 37 across the UK. But as the population ages, this is going to increase quite dramatically. Now, when the pandemic came along, we were able to offer fewer face-to-face appointments because of social distancing requirements, and group sessions had to be cancelled. The NICE says that people with Parkinson's should have access to a reliable source of information about Parkinson's, and that they should also have access to physiotherapy, occupational therapy, speech and language therapy, and dietetics. Not only when they run into problems as the disease becomes more advanced, but when they are diagnosed, that we consider arranging for them to meet these specialists to understand what they do and if there's anything that they can do to try and delay onset of certain symptoms. So just before the first wave of the pandemic, the specialist nurses and several of the multidisciplinary team members had come up with group sessions which were due to give people that information in one go, and also to be a social opportunity for people with Parkinson's and their families to meet other people in the same situation. But group sessions had to be cancelled because of the pandemic. Now, we saw a huge increase in the number of phone calls to the specialist nurses during this time. The team had already been thinking about developing a web-based application to provide information and advice to people with Parkinson's, but when the pandemic came along, that really showed that we needed to do something sooner rather than later. And my role this year has been project managing the developing My Parkinson's web application. And the web application is a source of providing reliable information, which is equitable because everyone has the same access to the same information. And also to reduce repetition by the specialist nurses often having to answer the same query time and time again to different people. We want to promote physical activity, and prevention is better than cure. And also that way, if people have got information about some of the things that physiotherapists, occupational therapists, etc. might provide when they're referred, then they can start having a look at that whilst they're actually waiting to be seen by that professional once they're referred, when we signpost them to it. We want to empower our service users to build self-management routines into their day-to-day structure and maintain independence that way. And we want people to understand the roles of the multidisciplinary team. For example, that speech and language therapists also help with swallowing, so that people know why they might have been referred there and turn up to their appointments. I've already talked about reducing repetition, but we also want to signpost to services that some of our service users could actually self-refer to, rather than needing to wait to see a clinician to tell them about that. Unfortunately, the My Parkinson's application isn't quite finished yet, but I'll explain a bit about where we've got up to. The first step was to identify the content that we needed to put in, what people wanted to know about. And so we analysed the phone calls that were made to the Parkinson's specialist nurses, and they came up with some useful recurring themes, but also demonstrated how broad the issues are that people with Parkinson's and their families face. So we looked at these and asked experts by experience, our service users and other members of the team, whether they thought that there were other things that needed to be included as well. This is a snapshot of the content map that we sent to the web developers. We grouped these themes and have come up with 57 written articles with advice and information written by 20 different healthcare professionals from 9 different disciplines. We've also made 16 videos. 8 different healthcare disciplines have made videos. Physio, occupational therapist, speech and language therapy, dietitian, clinical psychology, clinical nurse specialists for Parkinson's, consultants, general practitioners, and we've just had a social worker come on board who says that they're going to contribute as well. The name was voted for by our service users and they chose My Parkinson's. The votes were also from some healthcare professionals as well. I liked Park's Life, which was a pun on the Blur album, but unfortunately that one didn't win. So we went with My Parkinson's. This is the logo that our web developers have come up with. And we are so close to being able to start testing the My Parkinson's web application with some of our service users or family members of service users to get their feedback on it. And we'll take their feedback on how useful it is, how usable it is, and their suggestions for improvements and improve the application. And when we've got a product that we're happy with, we plan to present what we've done to other movement disorders services across Wales and across the UK. My Parkinson's has been designed to make it very easy to customise to different health boards or areas in the UK. So it should be easy for people to put their own local information in, but keep the core of the written articles and videos there so that they can use My Parkinson's with their local service users as well. The learning points that I really take away from my experience as a Bevan Exemplar and from this project is that change really is possible, even within the health service, but it does take time, especially when you're trying to do it in the middle of a pandemic and everyone you're working with is redeployed. And I was really glad to be a Bevan Exemplar because at the times when things got challenging and where I might have wanted to give up, I felt that I had that backup from them and the inspirational stories from other Bevan Exemplars who were overcoming challenge and adversity and bringing about change, but also the accountability, which was really useful. I've met so many wonderful healthcare professionals who are really keen to make a difference and to improve the service for their service users and their patients. People really want to help. And if you can provide a structure and a way of doing that, sometimes being a little bit bossy, then it can happen. Costs don't tend to always stick to the initial estimates. Is a useful learning point. So next time I'm trying to change something, I'm going to make sure that there is the budget is a little bit more flexible, and that there's spare for unexpected costs, because costs do tend to rise. Older people are online. There was a bit of scepticism about this from some parties at the beginning of this project. One of our medical students did a quick survey of our service users and found in a snapshot that 80% of them, of those surveyed, are online. And also the Office for National Statistics has published data from 2020, including the months before the pandemic really got going, as well as sometime during the pandemic. But they've said that the number of over 75s who are recent internet users doubled between 2013 and 2020. And certainly from talking to a lot of our service users, many of whom are younger than that, a lot of them are online. And disaster brings about opportunity. There have been the odd silver linings to the COVID crisis, and I think the ability for innovation certainly is one of them. So our next steps in the My Parkinson's project are testing with our volunteers, modifying based on user feedback, and developing an expert by experience section, which is going to be entirely curated by our service users and their families and carers. We're very keen to make sure that this is fully accessible in Welsh as well as in English, and so that's part of phase 2, making a bilingual version. We are considering putting in some voice control, voice activation options for people whose tremor is very severe, that it makes it difficult for them to click on things either on a handheld or mouse controlled device. And then we'll obviously then look to roll out across our own service, and then share our experiences and scale up across Wales and the UK after that. While I've been project managing My Parkinson's project, I just want to say a huge thank you to all of the other people who have helped along the way, particularly to Dr. Stephanie Wells, my assistant project manager, and all of the other clinicians and healthcare professionals who have given time, often out of their own time, to contribute to this project. And I know that it's going to be a great success, and we'll keep you up to date. And I'm very happy to take any questions.